Jessica and I'll be doing a sterile field and wound mastery. I have closed the curtains to provide patient with privacy while during this procedure, and I have set my table up to waist length to set myself up for success. So now I will do hand hygiene. Hello, my name is Jessica and I will be your nurse today. We are going to do a wound dressing on you, if that's all right with you. So I'm going to raise the bed up so I can have better access to my patient, as well as lower the railing down. Before we begin, may I ask you what your name is? Okay. And what is your date of birth? Good. And can you tell me, are you allergic to any tape or any type of latex? Okay, good. Well, even though you're not allergic to tape, I'm still going to use paper tape today. And let's see. From what I understand, you also took some pain medication earlier to help with your pain earlier. And you rated your pain as a 1 out of 10, so if that is still the same, I am not going to administer any more pain medication. Okay, good. And now I'm going to set up my sterile field. So if you don't have any questions, I'm going to get that started.
My name is Madison. I'll be your nurse today. First off, I'd like you to tell me your name. Okay. Date of birth. Any known allergies?
Now, before
Okay,
I
great.
put my
Well, today we're going to go ahead and place a nasogastric tube. This is supposed to help you get the nutrients that you need so that you can get to healing and get out of here a little quicker.
Before I begin, I'm going to assess your wound, do some hand hygiene, get some gloves on.
Okay, everything sounds normal. And now I'm going to get you to occlude one nostril for me. Breathe out. Okay, and do the opposite. Okay, great. So which one is easier to breathe out in? The right. All right, fantastic. We're going to go ahead and begin.
Pull the blankets back. Look at the wound, take this pad off and the gauze out.
I'm going to start by
Throw
measuring.
these away. Going to open up a new set of Q-tips. Assessing the wound, and it looks about 14 centimeters long, about 3 centimeters wide, and about 3 centimeters deep. I don't smell any odor. The peri-wound space is showing a little erythema, but it's for the most part pink, maybe a little red. The laceration here has a little granulation, and it looks like there's only about some serosanguis discharge. As I was looking at your pad, I didn't see any discharge on that, so that is a good sign. So now I'm going to throw this away, take my gloves off, and I'm going to put on my sterile gloves. I'm going to do hand hygiene first. Take the gauze, going to fluff it. There's no strings that I recognize. I'm going to get wet, get all the excess fluid out. Take a Q-tip and to put the gauze in the wound, making sure not to stuff it.
I'm going to go ahead and test the pH.
Looks like I may need another piece of gauze, so I'm going to throw that away. I'm going to take another piece of gauze here, fluff it, no
So I'm gonna
strings,
down to X-ray after this.
get all the excess fluid off, take
Are
the
you in
Q-tip,
pain? Are you having trouble breathing? No? Okay, great. Well, you
stuff
have
the
your call light.
wound,
If you need anything from me, just let me know. And
all the gauze in.
get you in.
Going to throw this Q-tip away, and I'm going to take the ABD pad that I have taken out, put it over the wound, and now I'm going to take off my sterile gloves right before I put on some tape. Going to throw the sterile gloves away, and I'm going to do some hand hygiene. And I've already set up the tape right here, so I'm just going to pull it out from the side. I also have another piece of tape that I have put the name, date, and time for this particular situation. Which will go on top so the next nurse that cleans the wound will know.
Or get again. Yeah, get again.
I am finished with this wound, so I will cover it up. Now, do you have any questions for me before I leave? No? Okay, so I will set you back where you were, and I hope you have a good day.